New tonight, the National Academies of Sciences, Engineering, and Medicine released a report that outlines a framework to improve health care for patients with sickle cell disease, a condition that disproportionately affects Blacks and Hispanics. Cronkite News reporter Harry Croton found out more from stakeholders about how this bodes for the disease, research, and treatment. Harry?
Sickle cell is the most common inherited blood disorder in the U.S., affecting some 100,000 people and occurring in 1 out of every 365 Black or African American births. But the country and the state of Arizona still have a long way to go to better understand the disease. The improvement process begins with several key factors. The exact number of those who suffer from sickle cell disease is unknown. To get a better handle of the numbers, the Centers for Disease Control and Prevention began a data collection program back in 2015. But only 9 states are enrolled, and Arizona isn't one of them.
Sickle cell is really the first molecularly characterized disease that we know exactly what caused it and how it caused it. But especially until only last year, very few treatments were available.
The lack of specific U.S. data has made the research process difficult, and the National Academies of Sciences, Engineering, and Medicine's near 500-page report outlines a plan to address the issue by increasing funding, broadening research, and most importantly, lowering costs for treatment.
There are multiple potentially curative therapies that are in the pipeline, but they're highly expensive, and we need to understand how to pay for them so we don't get trapped in a situation which I would say is worse than not having a cure, and that is having a cure that no one can get.
Another focus laid out in the report is improving the availability of healthcare professionals like hematologists, particularly in rural areas and communities of color. Martha Liggett of the American Society of Hematology says with the help of grants, they'll be able to add more sickle cell disease research and treatment centers across the country.
We're working on more general distribution for hematologists and for other healthcare providers and nurses and PAs. I mean, we need a whole team of people that are educated about how to deliver care properly.
Some experts say the lack of research and data has left patients feeling neglected. But Brett Jawar says part of the solution is placing a greater emphasis on funding.
Despite the fact that the CDC has a lot of money, it's really in buckets that it needs to be spent for. So you can't take funding out of measles and put it into sickle cell disease. So it's very important for all of us as we push forward to make sure there's advocacy for funding.
With additional funding, providers, and research, the report estimates 9 million children with sickle cell disease traits could be saved by the year 2050. Brooke Cook of the Sickle Cell Foundation of Arizona says just increasing awareness of the disease is one of the biggest challenges here. The foundation hosts virtual sessions to keep patients and their families informed. With just 3 hospitals in the state that specialize in sickle cell disease research and treatment, the National Academies plan could help on both fronts. In the broadcast center, Harry Croton, Cronkite News.